The nurse is reviewing drug therapy for hypertension. According to the JNC7 guidelines, antihypertensive drug therapy for a newly diagnosed stage 1 hypertensive African American patient would most likely include which drug or drug classes? A. Vasodilators alone. B. ACE inhibitors alone. C. Calcium channel blockers with thiazide diuretics. D. Beta blockers with thiazide diuretics. Answer: C. Calcium channel blockers with thiazide diuretics. Rationale: according to the JNC7 guidelines, calcium channel blockers and diuretics have been shown to be more effective in African Americans than in white patients. Thiazide diuretics are also recommended for newly diagnosed stage 1 hypertension. When counseling a male patient about the possible adverse effects of antihypertensive drugs, the nurse will discuss which potential problem: A. Impotence. B. Bradycardia. C. Increased libido. D. Weight gain. Answer: A. Impotence. Rationale: sexual dysfunction is a common complication of antihypertensive medications and may be manifested in men as decreased libido or impotence. The nurse is preparing for a community education program on hypertension. Which of these parameters determine the regulation of arterial blood pressure? A. Cardiac output and systemic vascular resistance. B. Heart rate and peripheral resistance. C. Blood volume and renal blood flow. D. Myocardial contractility and arteriolar constriction. Answer: A. Cardiac output and systemic vascular resistance. Rationale: blood pressure is determined by the product of cardiac output and systemic vascular resistance. Cardiac output is the amount of blood that is pumped out of the heart per minute. During a follow-up visit, the healthcare provider examines the fundus of the patient's eye. Afterward, the patient asks the nurse, "Why is he looking at my eyes when I have high blood pressure? It does not make sense to me." What is the best response by the nurse? A. We need to monitor for drug toxicity. B. We must watch for increased intraocular pressure. C. The provider is assessing for visual changes that may occur with drug therapy. D. The provider is making sure the treatment is effective over the long term. Answer: D. The provider is making sure the treatment is effective over the long term. Rationale: the physician would examine the fundus of a patient's eyes during antihypertensive therapy because it is a more reliable indicator than blood pressure readings of the long-term effectiveness of treatment. A patient has a new order for the adrenergic drug doxazosin, Cartera. When providing education about this drug, the nurse will include which instructions? A. Weigh yourself daily and report any weight loss to your prescriber. B. Increase your potassium intake by eating more bananas and apricots. C. The impaired taste associated with this medication usually goes away in 2 to 3 weeks. D. Be sure to lie down after taking the first dose, because first dose hypotension may make you dizzy. Answer: D. Be sure to lie down after taking the first dose, because first dose hypotension may make you dizzy. Rationale: a patient who is starting doxazosin should take the first dose while lying down because there is a first dose hypotensive effect with this medication. A patient with severe liver disease is receiving the angiotensin converting enzyme, ACE, inhibitor, captopril, Capitan. The nurse is aware that the advantage of this drug for this patient is which characteristic? A. Captopril rarely causes first-dose hypotensive effects. B. Captopril has little effect on electrolyte levels. C. Captopril is a prodrug and is metabolized by the liver before becoming active. D. Captopril is not a prodrug and does not need to be metabolized by the liver before becoming active. Answer. D. Captopril is not a prodrug and does not need to be metabolized by the liver before becoming active. Rationale. A prodrug relies on a functioning liver to be converted to its active form. Captopril is not a prodrug, and therefore it would be safer for the patient with liver dysfunction. When teaching a patient about antihypertensive drug therapy, which statements by the nurse are correct? Select all that apply. A. You need to have your blood pressure checked once a week and keep track of the readings. B. If you notice that the symptoms have gone away, you should be able to stop taking the drug. C. An exercise program may be helpful in treating hypertension, but let's check with your doctor first. D. If you experience severe side effects, stop the medicine and let us know at your next office visit. E. Most over-the-counter decongestants are compatible with antihypertensive drugs. F. Please continue taking the medication, even if you are feeling better. Answer. A. You need to have your blood pressure checked once a week and keep track of the readings. C. An exercise program may be helpful in treating hypertension, but let's check with your doctor first. F. Please continue taking the medication, even if you are feeling better. Rationale. Keeping a record of weekly blood pressure checks helps to monitor the effectiveness of the therapy. Remind the patient not to stop taking the medication just because he or she is feeling better. Abruptly stopping the medication may lead to rebound hypertension. Therapy is often lifelong, even though symptoms may improve. Many over-the-counter drugs, especially decongestants, have serious interactions with antihypertensive drugs. The patient needs to consult his or her prescriber before taking any other medication. An elderly patient will be taking a vasodilator for hypertension. Which adverse effect is of most concern for the older adult patient taking this class of drug? A. Dry mouth. B. Restlessness. C. Constipation. D. Hypotension. Answer. D. Hypotension. Rationale. The elderly are more sensitive to the blood pressure lowering effects of vasodilators, and consequently experience more problems with hypotension, dizziness, and syncope. The nurse is reviewing the orders for a patient and notes a new order for an angiotensin converting enzyme, ACE inhibitor. The nurse checks the current medication orders, knowing that this drug class may have a serious interaction with what other drug class? A. Calcium channel blockers. B. Diuretics. C. Nonsteroidal anti-inflammatory drugs. D. Nitrates. Answer. C. Nonsteroidal anti-inflammatory drugs. Rationale. Nonsteroidal anti-inflammatory drugs, NSAIDs, such as ibuprofen, can reduce the antihypertensive effect of ACE inhibitors. In addition, the use of NSAIDs and ACE inhibitors may also predispose patients to the development of acute renal failure. A patient with type 2 diabetes mellitus has been found to have trace proteinuria. The prescriber writes an order for an angiotensin converting enzyme, ACE inhibitor. What is the main reason for prescribing this class of drug for this patient? A. Cardioprotective effects B. Renal protective effects C. Reduces blood pressure D. Promotes fluid output. Answer B. Renal protective effects. Rationale. ACE inhibitors have been shown to have a protective effect on the kidneys because they reduce glomerular filtration pressure. This is one reason that they are among the cardiovascular drugs of choice for diabetic patients. A patient who has been taking antihypertensive drugs for a few months complains of having a persistent dry cough. The nurse knows that this cough is an adverse effect of which class of antihypertensive drugs? A. Beta blockers. B. Angiotensin converting enzyme, ACE inhibitors. C. Angiotensin II receptor blockers, ARBs. D. Calcium channel blockers. Answer B. Angiotensin converting enzyme, ACE inhibitors. Rationale. ACE inhibitors cause a characteristic dry, non-productive cough that reverses when therapy is stopped. The other drug classes do not cause this cough. The nurse is reviewing the JNC7 guidelines for treatment of hypertension. Which blood pressure would be classified as pre-hypertension according to the JNC7 guidelines? A. 118/76 of a millimeter Hg. B. 130/88 of a millimeter Hg circa 150/90 of a millimeter Hg. D. 160/104 of a millimeter Hg. Answer B. 130/88 of a millimeter Hg. Rationale. Prehypertension is defined as having a systolic blood pressure between 120 and 139 mm Hg and a diastolic pressure between 80 and 89 mHg. A pregnant woman is experiencing hypertension. The nurse knows that which drug is commonly used for a pregnant patient who is experiencing hypertension. A. Mannitol, osmotrol. B. Enalapril, Vasotec. C. Hydrochlorothiazide, hydrodiaryl. D. Methyldopa, aldamate. Answer D. Methyldopa, aldamate. Rationale. Methyldopa is used in the treatment of hypertension during pregnancy. A patient's blood pressure elevates to 270/150 of a millimeter Hg, and a hypertensive emergency is obvious. He is transferred to the intensive care unit and started on a sodium nitroprusside, nipride, drip to be titrated per his response. With this medication, the nurse knows that the maximum dose of this drug should be infused for how long? A. 10 minutes. B. 30 minutes circa 1 hour. D. 24 hours. Answer A. 10 minutes. Rationale. Sodium nitroprusside is a potent vasodilator and may lead to extreme decreases in the patient's blood pressure. For this reason, it is never infused at the maximum dose for more than 10 minutes. If this drug does not control a patient's blood pressure after 10 minutes, it will most likely be ordered to be discontinued. The other times listed are incorrect. A patient with primary hypertension is prescribed drug therapy for the first time. The patient asks how long drug therapy will be needed. Which answer by the nurse is the correct response? A. This therapy will take about 3 months. B. This therapy will take about a year. C. This therapy will go on until your symptoms disappear. D. Therapy for high blood pressure is usually lifelong. Answer D. Therapy for high blood pressure is usually lifelong. Rationale. there is no cure for the disease, and treatment will be lifelong. The other answers are not appropriate. The nurse is creating a plan of care for a patient with a new diagnosis of hypertension. Which is a potential nursing diagnosis for the patient taking antihypertensive medications? A. Diarrhea. B. Sexual dysfunction. C. Urge urinary incontinence. D. Impaired memory. Answer. B. Sexual dysfunction. Rationale. Sexual dysfunction is a potential nursing diagnosis related to possible adverse effects of antihypertensive drug therapy. The other nursing diagnoses are not appropriate. Why do patients on alpha-adrenergic agonists require close assessment of pulse, blood pressure, and weight? A. Because of strong vasoconstricting properties. B. Because of hypertensive effects. C. Because of strong vasodilating properties. D. Because of the risk of fluid overload. Answer. C. Because of strong vasodilating properties. Rationale. Patients on alpha-adrenergic agonists require close assessment of pulse, blood pressure, and weight before and during treatment because of these drugs' strong vasodilating properties and hypotensive adverse effects. Which antihypertensive drug is most likely to reduce vascular injury by inhibiting activation of growth factors that cause smooth muscle proliferation and hypertrophy? 1. Clonidine. 2. Terazosin. 3. Atenolol. 4. Candesartan. 5. Nifedipine. Answer. 4. Candesartan. A patient with a hypertensive emergency is given an intravenous infusion of a drug that dilates renal afferent and efferent arterioles and is rapidly metabolized with a half-life of 5 minutes. Which mechanism is responsible for the therapeutic effect of this drug? A. Activation of dopamine D receptors. B. Activation of dopamine D receptors. C. Blockade of alpha adrenoceptors. D. Activation of alpha adrenoceptors. E. Blockade of alpha and beta adrenoceptors. Answer. A. Activation of dopamine D receptors. Nitroprusside administration may lead to the accumulation of which toxic compound in the body? A. Formaldehyde. B. Bromine. C. Cyanide. D. Nitrobenzene. E. Superoxide. Answer. C. Cyanide. Which of the following is true of sodium nitroprusside, nipride? A. Sodium nitroprusside is administered by slow intravenous infusion. B. The duration of action of sodium nitroprusside is short, usually 1 to 5 minutes. C. The normal dose of sodium nitroprusside is approximately 3 mcg per kilogram per minute. D. All of these are correct. Answer. D. All of these are correct. Which of the following angiotensin converting enzyme inhibitors, ACEIs, possesses the shortest plasma half-life and duration of action and is administered 2 to 3 times daily? A. Quinapril, Acupril, B. Captopril, Capitan, C. Losartan, Cozar, D. Valsartan, Diovan. Answer. B. Captopril, Capitan. Select the correct statement related to the mechanism of action of aliskiren, Tecturna. A. Aliskiren interferes with the influx of calcium in cardiac and vascular smooth muscle and thus lowers peripheral resistance and blood pressure. B. Allospirin reduces cardiac output by blocking the beta-1 receptors in the heart. C. Allospirin inhibits the enzymatic activity of renin and decreases the conversion of angiotensinogen to angiotensin I, thereby reducing the formation of angiotensin II. Answer. C. Allospirin inhibits the enzymatic activity of renin and decreases the conversion of angiotensinogen to angiotensin I, thereby reducing the formation of angiotensin II. Select the primary indication for the use of minoxidil, Lonitin. A. Minoxidil is indicated for patients who do not respond to therapy with calcium antagonists. B. Minoxidil is indicated for patients who do not respond to triple therapy with other drug combinations. C. Minoxidil is indicated for patients who do not respond to therapy with beta blockers. Answer. B. Minoxidil is indicated for patients who do not respond to triple therapy with other drug combinations. Which of the following statements is not true of the vasodilator hydralazine, aprasoline? A. Long-term use may produce rheumatoid arthritis or a systemic lupus erythematosus-like syndrome. B. It is an arteriolar dilator used in moderate to severe hypertension in combination with both diuretics and beta blockers, triple therapy. C. The main adverse effects are GI disturbances such as dyspepsia, abdominal pain, and diarrhea. Answer. C. The main adverse effects are GI disturbances such as dyspepsia, abdominal pain, and diarrhea. Which of the following statements is true of the adverse effects of thiazide and loop diuretics? A. Thiazide and loop diuretics interfere with the synthesis of renin. B. Thiazide and loop diuretics interfere with the metabolism of sodium. C. Thiazide and loop diuretics interfere with the renal excretion of uric acid. Answer. C. Thiazide and loop diuretics interfere with the renal excretion of uric acid. In the context of the mechanism of antihypertensive action, which of the following is the treatment option to be used when the desired effect is to block the beta-1 receptors in the heart to decrease cardiac output and blood pressure? A. Clonidine, catapris, guanabens, hypertensin, and guanfacine, tenix. B. Doxazosin, Cartera, prazosin, minipress, and terazosin, Hytrin. C. Atenolol, Tenormin, metoprolol, Lepressor, and Nadolol, Corgard. Answer. C. Atenolol, Tenormin, metoprolol, Lepressor, and Nadolol, Corgard. In the context of the mechanism of antihypertensive action, which of the following combination of drugs is used when the desired effect is the stimulation of the inhibitory alpha-2 receptors in the vasomotor center of the medulla oblongata, which ultimately reduces the sympathetic stimulation to the heart, kidneys, and blood vessels? A. Clonidine, catapris, guanabens, hypertensin, and guanfacine, tenix. B. Doxazosin, Cartera, prazosin, minipress, and terazosin, Hytrin. C. Atenolol, Tenormin, metoprolol, Lepressor, and Nadolol, Corgard. Answer. Clonidine, catapris, guanabens, hypertensin, and guanfacine, tenix. Identify a true statement about the mechanism of action of the preferred diuretics used in the treatment of hypertension. A. Thiazide and thiazide-like diuretics cause an increase in the excretion of sodium in water, which reduces the blood volume and cardiac output. B. Loop diuretics cause an increase in the excretion of sodium in water, which reduces blood volume and cardiac output. C. Aldosterone antagonists cause an increase in the excretion of sodium in water, which reduces blood volume and cardiac output. Answer. A thiazide and thiazide-like diuretics cause an increase in the excretion of sodium in water, which reduces the blood volume and cardiac output. Explain the role of the kidneys in the development of hypertension. A. Activation of the RAA mechanism causes vasoconstriction and sodium and water release, which leads to an increase in blood pressure. B. Activation of the RAA mechanism causes vasoconstriction and sodium and water retention, which leads to an increase in blood pressure. C. Deactivation of the RAA mechanism causes vasoconstriction and sodium and water retention, which leads to an increase in blood pressure. Answer. B. Activation of the RAA mechanism causes vasoconstriction and sodium and water retention, which leads to an increase in blood pressure. Compare the blood pressure throughout the systemic vasculature. Select the true statement. A. Pressure is highest in the large veins and lowest in the large arteries. B. The largest pressure decrease occurs across the capillaries, indicating that they are the site of highest vascular resistance. C. The largest pressure decrease occurs across the arterioles, indicating that they are the site of highest vascular resistance. D. Pressure is highest in the arterioles and lowest in the venules. Answer. C. The largest pressure decrease occurs across the arterioles, indicating that they are the site of highest vascular resistance. Identify the pair of factors that determines cardiac output. A. Heart rate and peripheral resistance. B. Heart rate and stroke volume. C. Peripheral resistance and stroke volume. D. Heart rate and blood pressure. Answer. B. Heart rate and stroke volume. Mark suffers from mild hypertension. Which of the following is best suited to treat his condition? A. Diuretics. B. Diazoxide. C. Sodium nitroprusside. D. Vasodilators. Answer. A. Diuretics. Identify the first drug of the angiotensin receptor blockers class to be approved. A. Losartan. B. Captopril. C. Trindolipril. D. Aliskiren. Answer. A. Losartan. Kelly conducts a study on the effects of hydralazine, in combination with both diuretics and beta blockers, as a long-term treatment for severe hypertension. Which of the following would be a valid result of her study? A. A withdrawal reaction may occur, with patients experiencing rebound sympathetic activity and hypertensive crisis. B. Patients will experience dry cough and allergic reactions all through the treatment. C. Patients will experience hallucinations and depression all through the treatment. D. Rheumatoid arthritis or a systemic lupus erythematosus-like syndrome may develop. Answer. D. Rheumatoid arthritis or a systemic lupus erythematosus-like syndrome may develop. Essential hypertension differs from secondary hypertension in that A. The cause of essential hypertension is unknown. B. Essential hypertension as an acute disease. C. Essential hypertension requires no treatment. D. The occurrence of essential hypertension is almost negligible. Answer. A. The cause of essential hypertension is unknown. Which of the following statements is true of the vasodilator drug diazoxide? A. Structurally, diazoxide is similar to the thiazide diuretics. B. Diazoxide is a very potent vasodilator and has significant diuretic activity. C. Its hypotensive effects last for 1 to 2 hours. D. Diazoxide is used when the BP needs to be lowered gradually. Answer. A. Structurally, diazoxide is similar to the thiazide diuretics. The vasodilator drug minoxidil differs from hydralazine in that minoxidil A is indicated for patients who respond to triple therapy with other drug combinations. B is a more potent arteriolar dilator. C is given in usual doses of 60 to 100 milligrams per day in combination with a diuretic and beta blocker. D seldom produces any serious adverse effects. Answer. B is a more potent arteriolar dilator. Jessica is suffering from hypertension and, therefore, is given clonidine parenterally to treat her condition. If her treatment is discontinued abruptly, she may face withdrawal reactions. Which of the following statements holds true in this case? A. To avoid withdrawal symptoms of clonidine, her dose should be reduced gradually over a 2-day period. B. She will develop rheumatoid arthritis or a systemic lupus erythematosus-like syndrome due to the long-term use of clonidine. C. She may experience rebound sympathetic activity and hypertensive crisis. D. To avoid withdrawal symptoms of clonidine, she should switch to oral administration of the drug and a weekly transdermal patch. Answer. C. She may experience rebound sympathetic activity and hypertensive crisis. The main concern with the use of potassium-sparing diuretics is the development of blank, especially in patients who are also taking ACEIs, ARBs, or potassium supplements. A. Hirsutism. B. Thrombosis. C. Hyperkalemia. D. Thrombocytopenia. Answer. C. Hyperkalemia. Which of the following statements is true of angiotensin-converting enzyme inhibitors, ACEIs? A. It interferes with insulin and blood glucose regulation. B. Overdosage can cause hypotension and reflex tachycardia. C. It increases plasma lipids. D. Increase in the release of aldosterone and antidiuretic hormone. Answer. B. Overdosage can cause hypotension and reflex tachycardia. Which of the following is a similarity between angiotensin receptor blocking drugs, ARBs, and angiotensin-converting enzyme inhibitors, ACEIs? A. They cause adverse effects such as hypotension and GI disturbances. B. They increase bradykinin concentrations. C. They cause dry cough and allergic reactions. D. They can be used in normal doses during pregnancy. Answer. A. They cause adverse effects such as hypotension and GI disturbances. Identify an angiotensin-converting enzyme, ACE inhibitor. A. Aliskiren, B. Losartan, C. Chlorthalidone, D. Trindoliprol. Answer: D. Trindoliprol. Which of the following statements is true of angiotensin receptor blocking drugs? A. They increase bradykinin concentrations. B. They are orally active drugs and require multiple doses per day. C. They cause the dry cough and allergic reactions associated with the ACEIs. D. They are contraindicated during pregnancy. Answer: D. They are contraindicated during pregnancy. Select the preferred treatment for hypertension for patients with cardiac arrhythmias or ischemic heart disease. A. ARBs and diuretics. B. ACEIs. C. Calcium channel blockers or beta blockers. D. ACEIs and diuretics. Answer: C. Calcium channel blockers or beta blockers. Select the preferred treatment for hypertension for patients with renal disease. A. Beta blockers and diuretics. B. ACEIs and ARBs. C. Calcium channel blockers and diuretics. D. Thiazide and loop diuretics. Answer: B. ACEIs and ARBs. Which of the following is a difference between ACEIs and ARBs? A. Unlike the ACEIs, the ARBs increase bradykinin concentrations. B. Unlike the ACEIs, the ARBs bind to the AT1 receptor and competitively antagonize the actions of angiotensin II. C. Unlike the ACEIs, the ARBs are contraindicated during pregnancy. D. Unlike the ACEIs, the ARBs block the enzymatic conversion of angiotensin I to angiotensin II. Answer: B. Unlike the ACEIs, the ARBs bind to the AT1 receptor and competitively antagonize the actions of angiotensin II. A hormone that affects blood pressure by facilitating an increased excretion of sodium and water is A. Aldosterone. B. ADH, vasopressin. C. ANF-D, estrogen. Answer: C. ANF. Which one of the following chemical mediators can alter blood pressure via vasoconstriction? A. Prostacyclin. B. Endothelin 1C, nitric oxide. D. Prostaglandin E. Answer: B. Endothelin 1. Which of the following are categories of hypertension? A. Primary. B. Secondary. C. Malignant. D. All of the above. Answer: D. All of the above.